Good morning, presenters. Good morning, PAHO colleagues, civil society association, representative from the Ministry of Health, researcher, and invited guests. We are ready to start. My name is Claudina Cayetano. I'm the moderator for this session, and along with me this morning will be my co-moderator, Dr. Patricia Morsch. She's the advisor of healthy aging from the Healthy Life Course unit. And I would like to extend a warm welcome and thank you to all of you for joining us for this meeting. This is a technical meeting on the public health aspect of dementia in the Americas. The objective of this session is multifold. One is to improve understanding and awareness of the global burden of dementia, the global action plan of the public health response to dementia from WHO, which runs from 2017 to 2025. And for also the opportunity for us to become familiar on all the WHO tools and resources that are available and accessible to everyone who might need to use them. We will use this session to discuss approaches to research for coordinated response to dementia, especially in low and middle income countries, engage participants with lived experience of dementia and dementia caregivers in dementia inclusive initiatives, and of course, the importance of sharing lessons learned and good practices between countries to inform the development of regional and country-specific responses to dementia. We are very fortunate that for this technical meeting, we have translation in 3 languages. And all you need to do is, the instructions are on your screen. So there is, there is a button and you choose the same language, that's the language that you choose to listen and to speak, you stay in that language. So the translations are available in 3 languages. We have Spanish, English, and Portuguese. So we're ready to start. And without further ado, I will give the mic to Dr. Renato Oliveira, who is the Chief of the Mental Health and Substance Use Unit here at the Pan American Health Organization. The mic is yours, Renato.
I'm sorry, one moment, please. La persona que está haciendo la traducción en español, por favor, necesitamos que traduzcan en este momento. No se está escuchando. Ahora sí se está escuchando. Gracias.
Sí.
Over to you, Renato.
Thank you, Claudina. Good morning. Good morning, and thank you for joining us today. My name is Renato Oliveira Souza. I'm the Unit Chief of the Mental Health and Substance Use at the Pan American Health Organization. I want to start by taking this opportunity to extend a warm welcome to all our speakers and participants. It's a pleasure to welcome our colleagues from WHO and PAHO, partners from regional and national associations and foundations, academics, and PAHO member state representatives who are participating in today's technical meeting on the public health aspects of dementia in the Americas. I'm just having an issue here with the translation. Is everyone hearing well?
Yes.
Okay, so then let me continue. Prior to proceeding, I would like to thank all of the panelists for joining us today for this momentous event. In addition to this, I'd like to show my gratitude to Ms. Paula Barbarino, Dr. Enrique Vega, Dr. Tarun Dua, and our colleague from WHO for joining us. Finally, I would like to thank Dr. Claudina Caetano and the team for the excellent job in making this technical meeting a reality. This technical session aims to raise an important multi-sectoral discussion on dementia as a public health priority and to engage member states, civil society, people with lived and their carers in a dialogue about solutions to reduce the treatment gap and increase access to early identification and care for dementia in our region. More than 10 million people are living with dementia in the Americas. Dementia has profound impacts on individuals, families, communities, and society. Many countries in our region is still surrounded by stigma and misunderstanding. People living with dementia, their family members and caregivers continue to experience discrimination and can be denied their fundamental human rights. PAHO's strategy and plan of action for dementia, which concluded in 2019, aimed to guide member states in addressing the high burden due to dementia and to improve the quality of life and well-being of people with dementia and their families and carers. COVID-19 pandemic has had devastating consequences for our region, particularly for the mental health of populations and the provision of services for mental, neurological, substance disorders brings to the forefront the need to improve access to and the quality of services and support for people living with dementia and their carers. The past year and a half have shown us that we cannot rest on the achievements we have made up until now. Rising rates of dementia and its marked impact on our region require accelerated actions and interventions by member states, together with civil society and other strategic partners. Many countries within our region, dementia continues to be stigmatized and misunderstood. People living with dementia, their family members, their caregivers continue to experience discrimination and denied human rights. Thus, the rationale for this session, the effort to encourage member states and all of us within the region to increase public awareness and understanding of dementia and the importance of developing dementia strategies firmly rooted in national health strategies and that are multi-sectoral, move areas beyond health, as well as the community, people living with experience and their carers. In ending, I'd like to re-emphasize PAHO's continued commitment to supporting the state in addressing mental health and substance use within the Americas, and we really welcome countries seeking technical cooperation in addressing these concerns. I'd like to once again welcome our speakers and encourage participants to be actively engaged in today's session. Thank you very much, and I hope you have a great webinar.
Thank you very much, Renato, for your warm welcome. And we indeed hope to have a productive and interesting, exciting webinar. So our next presenter as part of this official opening is Dr. Tarun Dua. Dr. Dua is no stranger in this work. She has led the work on dementia, including she did the first WHO Ministerial Conference on Global Action Against Dementia. So I'm sure most people who have joined us this morning are quite familiar with the work that she's been doing and the development of Global Dementia Observatory. And today, Dr. Dua will be sharing with us, so we can start the presentation. She'll be sharing with us global context of dementia, a public health priority, global context, and the progress to date. Dr. Dua, the mic is yours.
Thank you very much, Claudina. So first of all, checking if you can hear me well.
Yes, we can hear you and we can see you. Thank you.
Great. There was some audio problem, so hoping that the sound doesn't break and the interpreters can get it well. My pleasure to be in this meeting. I was told that we have 96 registrants from across the PAHO countries. So congratulations to Renato, Claudina, and Enrique for mobilizing across the ministries as well as civil society to join this workshop on dementia. And this is important for two reasons. One, we have the global action plan on public health response to dementia, but also in context of COVID-19, We have seen that people with dementia are more impacted, they have severe outcomes, and there are serious concerns in relation to post-COVID-19 condition, which may have cognitive impairment. Next slide, please. So this is important as we review the progress. The action plan was endorsed by the World Health Assembly in 2017. It is until 2025. So the question is, where are we in achieving all the global targets? Now, before we go on to that, I think it will be preaching to the converted if I talk about why dementia is a public health matter. And but just to say that it is the number and the cost that make it extremely important that countries should work on it. As part of the global status report on dementia that WHO recently published, in 2019, there are 55 million people living with dementia and estimated to increase up to 140 million by 2050. The cost is 1.3 trillion USD estimated in 2019, and by 2050 it is will be more than double, 2.8 trillion US dollars. One of the things that in our public health discourse that we don't talk about is in terms of the dementia as a leading cause of death. It is amongst the top 10 leading cause of death. And one of the things we do not pay more attention is in relation to the burden that is in women in terms of whether it is the deaths, whether it is in terms of the caregiving burden, whether it is in terms of actual number of diseases. So whatever policies that we talk about, gender sensitivity is extremely important. I earlier mentioned about our global targets, and in the nice graph, and if we look at the road to achieving the targets by 2025, you can see that we are very much far behind, be it in terms of policy and legislation. So that's the first one on the top right that you can see. It is around 50 countries that have standalone or integrated, and by 2025, the target is 140. And the speed at which we are going, we will not be able to meet our targets if we do not do more in this area. And same is true for dementia awareness, risk reduction, diagnosis, treatment, care and support for dementia caregivers, health information systems, research and innovation. So what I'm going to touch upon is what can be done as we move forward, and I think we need to change our gears for the next phase of the work so that we are able to achieve some of the targets that we signed on in 2017. Next slide, please. Okay, yeah, thank you very much. So we talked about the policies and legislation, and just as an example on this slide, I talked about the global number, but making it specific for the region, it is only 11 out of 35 countries in the region which have a standalone or integrated dementia plan. And there is guidance available from WHO in terms of how such a plan, whether standalone or integrated, can be done. And I think what we have seen is it may not be in the health, it may be in other ministries. It requires mental health, aging, neurology, a cross-sectoral collaboration to have such a plan and then to implement it. Next slide, please. For awareness, dementia awareness is the first step towards having any action. And I should congratulate PAHO for the one region where such an awareness campaign in collaboration between PAHO and the civil society was carried out. Let's talk about dementia. And I think, and you would agree with me, that much more can be done in taking these messages from the awareness campaign that has been implemented earlier. I also wanted to talk about the importance of dementia friendliness and working with, for example, banks, supermarkets, and teachers, students, that how the society can be dementia inclusive. And there's a very nice toolkit available that can be implemented at national level to make our society dementia friendly. Next slide. We know that currently there is no cure for dementia, but we know that dementia can be prevented. There is sufficient evidence that is available. Risk reduction guidelines from WHO have been published, and it has also been converted into an mHealth solution. And this is a simple solution, part of Be Healthy, Be Mobile. And this can be implemented at national level. There are series of SMS messages that can be sent out, and it can increase the awareness about the dementia prevention and risk reduction. Many of these are similar to what we talk about, non-communicable diseases. And thus, this is an extremely important example of the integration and the synergies that is required across different areas of work. Next slide. As I mentioned, there is no cure. There is much that can be done to provide currently care for people with dementia. This requires working closely with the work that is happening in the area of aging. You may be aware of the tools such as ICOPE. Also within the mental health, dementia is part of the MHGAP. I know MHGAP has been implemented across many countries. It is available in Spanish, e-version is available, different tools are available. It is about how do we take the dementia module of MHGAP and use it for better care through the primary healthcare system and including it part of the universal health coverage. Because much can be done to avert the burden if proper care is provided to people with dementia. Next slide, please. And part of providing care is supporting the caregivers. And I talked earlier about COVID-19 and just wanted to emphasize that one of the important services that has been disrupted because of COVID-19 is the support to the caregivers. Many of these tools are available, which are online, hard copy manuals, videos, brochures through the M-Dementia support that I already talked about. So, and this is such an important area. And this is, if we want caregivers to take better care for people with dementia, we need to support them so that they can also take care of their own health and well-being. Next slide. And lastly, I know that a lot of research is happening in PAHO. There are a couple of countries through which consortia are being working, like the STRIDE network that is there. But what is important is that we need coordinated action, we need implementation, research, and we need all of the collaborations which focus on low and middle income countries. And so, and this is important if we think in terms of our target around the research output. And I think that's where much more research is required, which is bottom up from low and middle income countries. I haven't talked about the Action Area 6 if you were counting the numbers, because that's on data and Global Dementia Observatory. And my colleague Catherine is going to discuss that in detail, because data is extremely important. If you do not have data, it means that there is no problem, that means no action. And I think that's where, and that's why having good data is extremely important. That should be my last slide, Claudina. Thank you very much. And I hand it back to you.
Thank you very much, Tarun. There's so many take-home messages from your presentation. Definitely making the point of, making dementia as a public health priority. I think, seeing that we are still, even though from 2017, and we're going to 2025, we're still far behind from every global target. and that dementia is among the top 10 causes of death, which I don't think sometimes we pay attention to that. So many take-home messages. And what I like about your presentation is the fact that you also presented on what we can do, what civil society, Ministry of Health, and all stakeholders can do, highlighting the different interventions from the 6 global areas, because we'll be joined by our colleague Catherine to talk about number 7. So thank you for all your support. We're so happy to have you. We'll have a section on Q&A, so please stay with us. And colleagues, you also know that this session is being we are also recording the session, so we'll be able to share with you the presentation and the link. So with this now, we don't have with us, the next part of the session is a video presentation from Ms. Paola Barbarino, the CEO of ADI. She apologized for her absence, but she sent us a recording. So we listen to the recording now. Thank you. And thanks, Tarun. We're not hearing?
Yeah, there is no sound.
Yeah, there is no sound.
I'm sorry, Andrew, you can open your microphone.
Good morning, ladies and gentlemen. Thank you for inviting me, and sorry for not being able to be with you at this time. I'm Paola Barbarino. I'm the CEO of Alzheimer's Disease International, which is the global INGO representing 105 National Association of Alzheimer's and Dementia, and in official relations with the WHO, and therefore with you all. Now I'm going to share my screen. And today I'm going to talk about an important topic, the importance of timely diagnosis, spotting the early signs of dementia, and advances in risk reduction. This is anchoring it with the Global Dementia Action Plan of the WHO. So just so that you are clear, vis-a-vis public awareness campaign, 100% of countries should have one by 2025. We're still very far away from this target. And as far as diagnosis is concerned, at least 50% of countries, as a minimum, 50% of the estimated number of people with dementia should be diagnosed by 2025. Once again, we're very, very late, as I'll show you later. This is our campaign on the timely diagnosis on the early signs of dementia. We launched these during the 2021 World Alzheimer's Month campaign, that was September. The idea is that in seeking out information, advice, and support, and potentially a diagnosis, people are better able to prepare, to plan, and to adapt. The public does want to know, and so it's important that diagnoses are offered. Having said that, receiving a diagnosis of dementia is often a challenging and a very difficult process. And then the stigma surrounding dementia means that many avoid a diagnosis. And indeed, our report on this that we commissioned Journey to the Diagnosis of Dementia confirmed that about 33% of practitioners, so medical practitioners, don't even bother giving a diagnosis as they perceive there is nothing to do. But there is a lot that we can do to help people that have dementia, and the families can prepare and they can know what is going to happen. And in any case, the public want to know. We've run several surveys, and therefore it's a right to know whether you have a disease or not, as we well know. We commissioned this report to McGill University in Montreal, and it focuses on the global perspective on current dementia diagnosis, the practices, the barriers, the facilitators. It's a wealth of information, and I strongly recommend to download and read at least the executive summary. But let me tell you a few of the surprising finds. Globally, we estimate 75% of people right now are not diagnosed. So if there are 55 million people in the world with dementia, the 7th leading cause of death globally, well, then it means that 41 million people are currently not diagnosed. The rates of diagnosis are inversely related to the income of countries, from around 60% in higher income countries to above 90% in lower middle income countries. And the globally aging population plus a diagnostic treatment breakthrough coming through and possible blood biomarkers on the horizon will certainly create a great demand, a tsunami of demand that healthcare systems currently are not prepared to receive. You also asked me to speak about advances in risk reduction. This is our chart on risk reduction. We partnered with PAHO to deliver the World Alzheimer's Month campaign, Let's Talk About Dementia in 2020. And that highlighted the importance of risk reduction. Let me focus on a couple of points that are currently not fully well understood, or perhaps they're new. One is hearing impairment. It is now demonstrated that it is really important to wear hearing aids when hearing loss occurs, as dementia can set up quicker, the cognitive deterioration is quicker in absence of hearing. Another interesting one, which is fairly new on the list of dementia risk factors, is air pollution. A lot is believed to be related to pollution, but there is still not enough really studied around that. Other elements like sex education, for example, or infrequent social contact are less well known, but still very, very important. Now, let's be clear, the national dementia plans are extremely important. The global action plan on the public health response to dementia is critical. Governments must prepare for a tsunami of demand for healthcare services as a result of a number of issues. And the national dementia plans are the best way to face these, and we recommend them to follow it. But in PAHO, only very, very few nations have national dementia plans. We are now launching a very important campaign to highlight to governments the absolute emergency and the fact that there is a need to start working on this now before they're overwhelmed by demand. And we would really love to partner with PAHO and to use your insights about which government may be best placed to start working with, in the hope that others will take their examples and follow suit. And with this, I thank you very much for your attention. Goodbye.
Okay, fantastic. So this concludes the official opening of the technical meeting. It was interesting to hear the conversation, the presentation from Paola. And as you saw, she talked about the campaign that PAHO did well in coordination with ADI. Let's Talk About Dementia campaign, which was in 2020. I think it's still, important that we continue to talk about dementia, and even up to 2022. This will continue to be relevant. So we finished with that section on the official opening. Now we are on time perfectly, 9:30. We are moving to the presentations that we have. We put together a very exciting agenda for you. We have exceptional presenters who will share with us their diverse knowledge and experience. The first presenter will be Dr. Enrique Vega, our colleague and friend, and who will be giving us the regional context, referring to what's happening in our region and here in PAHO. Then will be followed by a section on research, a section on country experiences and lessons learned, and as experiences from the persons with lived experiences. Then the section on the 6th global action area, which is GDO. We'll also have we want to have at the end of this, we're having a section on Q&A. So please feel free to present your questions for today to the presenters at any time in the Q&A section, and our colleagues from PAHO will be monitoring that chat so they'll be able to direct the question to the appropriate presenter. So with that, we pass the mic to Dr. Enrique Vega. Dr. Vega, over to you.
Muchas gracias, Claudina. Muchas gracias, Renato.
Thank you, Claudina. Thank you, Renata, for this initiative, for this opportunity to participate in this important topic that has been a matter of concern for a long time to all of us in the region of the Americas, We are the first region that had a global action plan for our region. And then despite the fact that we still have a long road ahead of us, we need to give support to our countries. And also, all of these matters are essential. I will be brief. I try not to speak in the Cuban accent for the sake of the interpreters, but I will tell you about the situation in the region. One of the most important things in our region is the demographics and the geographical location. Of course, risk factors, but just the demographic transition, the accelerated aging of the population in Latin America and the Caribbean will mean that there will be a significant increase in the number of people suffering from dementia. Age continues to be a risk factor, is an independent factor for the development of this disease. We see in the region of the Americas, we're seeing fast rate of aging. By 2030, we will have zero aging. That means we will have more members of the aging population or the aged population than people that are younger in comparison with the rest of the world. But we do not only see accelerated aging, but also aging within aging. And this is important to consider because there will be people over 80 years of age. You will see this line is almost vertical. And then we see the number of people that are older than 80 years old, not only in the region of the Americas, but also around the world. And then we can have to think of dementia high prevalence in this population.
Va a significar un incremento importante.
Just the demographic transition in this population will mean a significant increase in the rates of dementia. But that is not only problem. We see the fast epidemiological transition. As you can see, between 2009 and 2019, we have seen different degrees of transition. One of them from infection diseases to chronic diseases. We have an important increase in chronic disease, but also the burden of disease. We see how the burden of disease changes from the first part of life to the second part of life. And we have seen this transition in a 20-year period. And these modifications undoubtedly continue to be a challenge for our public health systems and how we can cope with this. So the most important thing in this process is that we have seen an increase in the gap in life expectancy and healthy life expectancy. Life expectancy in the region has increased over 20 years in the past 50 years. And we have also seen an increase in the healthy life expectancy. But the rate of increase and the depth of increase for healthy life expectancy has not been enough to be able to pair this with the life expectancy itself. So this has meant that there has been an increasing gap, a significantly increasing gap among all ages. And today, this makes a difference of 11 years in life expectancy and healthy life expectancy. Well, I think this is one of the main challenges that we have. We see 11 years of difference. If we have a person also with disability and functional impairments, well, of course, this require a lot of care. Now, when we try to understand that increase in the gap in the life expectancy and healthy life expectancy, we have to understand the impact of neurological conditions, especially dementia here in red. You see here, dementia means an increase, a tremendous increase in the burden of disease. despite all the other problems that we have underlined here, lack of diagnosis, and not knowing the prevalence in the countries, in addition to this, we see an increase. And then in this cause of death and disability, we add the burden of disease associated with this, and then we add Alzheimer's disease and other dementias. We see that it occupies number 3. We have already mentioned this, the leading causes of premature mortality among older people over 65. We see Alzheimer's in 1990, and then also in 2019. In the case of men, we see also the 9th place, and in the case of women, the 4th place for deaths in the region. So we see a significant increase in the past 20 years, despite all the problems that we have already mentioned here. So the burden of dementia, and you already are familiar with that, and this is, of course, aggravated by the increase in disability. And that increase in disability is clearly reflected in the dailies, added to a higher burden of disease in people over 60 years of age. And so this plays an essential role here. So another important thing that is like the prism of dementia is the increase in the number of people over 60 that need care. So today, dependency is associated with people over 60 years of age. And of course, dementia is the best example of the challenges that we have when we have disabled people. So for us, it is essential to understand that the demographic transition shows that the families have essential limitations in this because of these disabilities. And then today, most of the disability care is absorbed by the families to be able to provide this care. So this is just an example. I know we will be sharing more on this. We have an analysis that we have been developing on the capability of the systems to solve this problem. So we have a case in point, which is Brazil. We have an important impact of the number of people with disabilities, and then the burden for the health systems and the health services to be able to care for this population. So we, of course, see the effects of the COVID-19 pandemic. We see the extra challenges created by it, especially in people over 60 years of age. And we have focused on the dependency of all of these people, whether they live in the community or whether they live in institutions. We see dementia associated with the socioeconomic status, the development of health systems. So it doesn't matter which angle you analyze this from. COVID-19 has created more serious conditions for the people that are dependent. And this, of course, has been reflected in the way in which the health services have been able to respond to these challenges outside direct care to COVID. And so we see the burden on mental health services. But when we talk about mental health services and age and care for the aging population, we see an incidence, a higher incidence of these problems. So this is a summary of what we have said today. We need an essential change in the care of these people. The decade of healthy aging could be a good opportunity to try to revisit this topic. And so this decade proposes relevant topics, the way in which we can change the discourse, what we think, how we feel, how we act about aging, and especially about dementia. We underlined this in the 2020 campaign. So we have to have people-friendly environments for the elderly, especially for the elderly affected by dementia. And of course, we have to have essential changes in the way the health systems and services respond to the needs of the people with dementia. So I think we have already heard Taruk mention this, the early detection of cognitive impairments is one of the main and fundamental factors to be able to care for these people. So that's a very good proposal. And we have been working with this vis-a-vis the aging of the elderly population to propose changes so that the people themselves can improve their intrinsic capacities. You see here, the cognitive capacity here is a very important point, also sensitive capacities. So the course of life approach is fundamental for us. We have to recognize that this is an essential idea to be able to work in mental health. Our colleagues in mental health have been working on this. Most people over 60 years of age in this continent in 2050, 2060, people who are 30 and 40 years of age, they already have some of the risk factors that they will have when they get to be 80 years of age. So dementia should be a clear vision, and it requires action. These are my messages today, and thank you so much for having had me today.
Excellent presentation. Excellent, colega, amigo. Enrique, muchísimas gracias. Thank you.
Thank you so much, Enrique.
It's something that we need to keep in mind, the fact that the epidemiological transition, we're getting older faster. So the challenges that this brings to the health system, to family. Oops, you have provided a lot of food for thought. We need to start to think what it is that we will be doing as together to make sure that there is some changes that needs to happen. And you also brought the importance of COVID. I mean, we haven't touched that, but COVID is a reality, and especially when it comes to our mental health. So you provided that context, that backdrop for the remainder of this meeting, and thank you very much. So stay with us, and as I say, if you have any questions for the presentation that we just heard from Dr. Vega, feel free to put that in our chat. So we are now moving very quickly. We're on time. Let's move very quickly. And I will ask my presenters for this next panel. We have 3 presenters for this next panel to please stick to the time. We don't want to be interrupting you, but we want to make sure that you keep to your time. So we have this is a panel of 3 presenters discussing lessons learned on selected action areas of the WHO Global Plan of Action. So the first person is Dr. Dr. Roman from the Department of San Juan de Dios, and he's the member of the Alzheimer Association in Costa Rica. Then it will be followed by Licenciado Manuel Linares from the Association of Lucha contra el Mal de Alzheimer, ALMA, in Argentina. And the third presenter would be Dr. Christine Lucam from, she's the chairman of the Foundation of Alzheimer, another dementia in Suriname. So the mic is yours, Dr. Roman. Le vamos a ir viendo con los tiempos acá.
Buenos días.
Good morning. Good morning. Greetings to all of you working in dementia. I see many known faces, wonderful people who also participate here from the civil society. Here, I bring greetings from Costa Rica, from all of Central America, as a representative of the multidisciplinary Confederation of Association of Alzheimer in Central America. And my message is very clear, but also simple. What is the next step? Well, I will tell you in my 8 minutes of talk, why do we have to have a next step? Well, I have to tell you that in Central America, we have identified some epidemiological characteristics. It looks like we are a red spot for dementia. We have a higher prevalence than all other age areas of the planet. There are many cultural frameworks. We have here a Central American nation that has a specific historical background, and we have several risk factors that are being studied in the region. And also we have several political factors at the level of the Minister of Health. We have an agency called Comisca. And then during the pandemic, we have seen one more risk factor for dementia. And this is the phenomenon that occurred in the region. In 2014, we had something really important. When we had the birth of the Alzheimer's plan in the civil society in 2014, our Alzheimer's associations from the region that had been in existence already for 20 years, they were the child of the civil society. And this happened in Costa Rica in 2016. And then Costa Rica became the first country in low and middle income country to have this program of Alzheimer's. That was good, but it's not enough. In parallel, throughout this time, we have to think in regional terms. We have to export our thoughts. We have to exercise leaderships in Central America among our friends. So we ended up in the Central American Alzheimer's Conference. In 2014, and from 2014 to 2020, we could say that this region has had 4 regional Central American consensus meetings. We have imported and exported and exchanged Alzheimer's plans. We had signed 3 agreements from Comisca, from Ministries of Health. One of them, which is transcendental because I don't know if you knew that we have mental topics as a priority for the study of dementia. And so that has come out of the civil society. From the civil society, we see many things. The strategy for dementia treatment in Latin America had a period of analysis, and this came from civil society. And then we have had 2 regional congresses in the Americas, Central America, Costa Rica, and Guatemala, one of them held in Costa Rica in 2016. And then we had 5 elements that were essential during this historical Congress. And then we centered on the main elements to be able to achieve the dementia treatment plans in our region. And then also we have an interesting thing here that was the regional campaign to fight dementia. So we believe that we can take the next step, and then that civil society is a valuable partner, is the key that opens the door to help with political participation. And Costa Rica wants to send out the message that civil society is part of the Mental Council, or the Council of Mental Health. And on many times I have asked if this is a phenomenon that is repeated around the world, but if that is not the case, I would say we have to repeat this in every place, because when civil society participates, it has a voice, it has a vote, and it has ideas that is encouraging. I don't have a written presentation. I will give you my main and final point about how Alzheimer's can create political links And we will be having a 5th meeting on Alzheimer's with the Minister of Health of our area to be able to say, yes, here, we're present. And then there's something that unites us as a region, and that is that we work jointly. We work jointly to control risk factors and to analyze risk factors. And we hope that with the help of all the friends at PAHO and around the world and the civil society, we will be able to generate more favorable actions. And then finally, I would like to tell you that in Costa Rica, the dementia diagnosis is compulsory. And that is important because before it was invisible. And with this, I finished to take into consideration the time allowed. And please feel free to ask any questions. Greetings from Central America, from each one of our friends and partners that day to day in the civil society are fighting against dementia, and greetings from Costa Rica. Excellent. Thank you so much, Dr. Roman. The truth is that we would like to congratulate Costa Rica for the achievements attained. And also thank you so much for your presentation and the fact that you have observed the time allowed. And so we give the opportunity to the next speaker. If you have any questions for Dr. Roman from Costa Rica, continue to write down your questions. We have more than 119 people connected to this meeting, and we're very grateful because you have taken the time to be with us. So now, Mr. Juan Manuel Linares from Alma in Argentina. Thank you so much, and good morning to all the participants. It is a real pleasure. Good afternoon or good morning. Thank you so much for your presentation. It is a pleasure for me to be here addressing this forum today. In a few minutes, I have a degree in economics. I am in charge of the Alma Cava in Argentina. This is an organization that has existed for 32 years in our dear city of Buenos Aires, and we have founders of the Ibero-American Society, and we are active participants in ARI, and also in August of this year, we established RADA. This is an organization that works on Alzheimer's in the Argentine Republic, and it covers 18 cities around the country to continue to incorporate the cognitive impairment that happens with Alzheimer's. Unfortunately, I say, as an economist in all parts of the planet and in Argentina, we have high statistics as to how many trees we have, how many animals we have, how many things. But unfortunately, we don't have the statistics on Alzheimer's, even though we have statistics on all other things. And then we have to report to the World Health Organization. Most unfortunately, I must say again, and very sadly, that my country has been absent from these type of statistics. And then given the institutional levels that have considered this at the world level, when it comes to the World Organization and in the communities and all the efforts that have been contributed, we have concentrated just in passing. So we didn't have this in mind as at the beginning. Well, I am a member of a person with Alzheimer's in the community, and then that's how I had to make myself present to start working in dementia at the time that this happened. So the most important thing that I say is that we need to start at the regional level, at the Latin American level, a presence, an involved presence of official, national, provincial, regional, municipal entities in the political work to make sure that we tackle the problem of dementia, because dementia is everywhere. I didn't have the opportunity to make more comments in the IEB Congress that ended in October, and the G20 was meeting in October. At the G20, the presidents of G20 asked for the presence of ministries of health around the world from G20 countries. Those of us that had health as a priority, as a #1 priority, also were accompanied by the ministries of economy or economics. But I must say that for the first time in so many years of having the G20, ministries of health were called to attend so that they could give their message, they could express their position on this topic. So for that reason, I am pleased to say that Argentina participated in this, and we had the presence of social psychologists at the Latin American level. Also, they have their contribution to make because we have to consider childhood, we have to consider adulthood, and then of course, aging. That is very important. In addition to economics, I am interested in nature. So I have incorporated myself as an anthropologist to establish the different types of animals also into the picture. And in this case, I think we have many animals that really do not abandon their own weak specimens. So for that reason, we have to accompany these people who are aging. When people are young, do not think about these things, but beyond this and beyond this work that Bajo has brought to the forefront about the Alzheimer's problem, I am convinced that as people who are part of a herd and we're present here in the world, we have to get together, join hands, and solve problems of all types.
We can't integrate the older if you don't integrate the young baby that's going to take care of that elder and who has to participate in this humanitarian living together, if you wish. And as the speaker who spoke before me, Enrique Vega, who showed some statistics of which I, as an economist, have followed very closely, for other aspects, I'd like to join my expertise and my knowledge as an economist from Argentina. It's not. I mean, what I mean to say is the statistics helps promote in terms of health, those things that benefit all of us as a community and our scientific community, which we have here in Argentina, people like Dr. Taragano and Dr. Alegre and Dr. Cecilia Serrano, who are mainly neurologists and very important locally and internationally in Latin America. We live here and communicate daily to really manage to get the large cities and large municipalities and the large governments of our country open the doors to us, get them to open their doors so that the statistics and the presence of Alzheimer and the cognitive deterioration suffered by the population at this time become something that is important and be at the table. Since September, with the World Alzheimer's Day in the city of Buenos Aires, for the first time in 32 years, we managed to light up some emblematic buildings and added people who supported us and who followed us and were willing to help us and were actually present and be aware, and hopefully we'll be able to repeat something similar in our dear country of Argentina. Having said this, I will leave now, and anything you need about Argentina, we're here for you. Thank you very much and good day. Good day to you, and thank you to you as well for your support, for everything you've done in Argentina. We really want to thank you for keeping within your time, and congratulations for everything that you're doing, for all your commitment, for all you're working with. And we're thrilled to be able to continue to work with you from PAHO. We've heard the presentations from Central America, South America, and now we're going to hear a presentation for the Caribbean. And we're going to invite Dr. Christine. Thank you.
So Dr. Christine Luckman, she's the chairman of the Foundation of Alzheimer and Other Dementia. She's doing her presentation from Suriname. The mic is yours.
Thank you very much. Hello, everyone, and thank you for having me. I'll start sharing my very short presentation. Well, as you said, I'm the chairperson of the Association of Alzheimer's in Suriname, but I'm also a clinical geriatrician, and that bit of information is important for my story. The motivation of our association, of course, come in part from the wonderful work done by the Pan American Health Organization, the WHO, and of course the ADI. Friends and family are motivating us, and this is very important for the work we do. But in all honesty, our most important motivation comes from the people living with dementia, mainly my clients that I see every day and their family. And it's when they walk into our office, the complete bewilderment and fear that we see in their face, and the confusion that we see in their eyes, that motivates us to do the work that we do. And the caregivers that are on the verge of emotional breakdown, those are the things that are for us very important and stimulate us to work. The association is now about 3 years. We are fighting to get a national dementia plan in our country. And the stories that we hear from my clients, from their families, the complete misery that they're going through because there's no help to get. With the financial situation, they cannot afford to pay for additional help. Being sent from one government office to another government office, looking for any form of help and not getting any, because there are no systems in place yet dealing specifically with dementia in our country. So this is really the motivation for us to fight to get a national dementia plan. Like I said, 3 years now we're fighting to get a plan created, written. And the things that most of all we've encountered, the problems that most of all we've encountered is the switching of persons, in the sense that in the last 3 years we've had to deal with, I think, 3 different ministers of health, 3 different directors, because the government, of course, has recently, well, a year ago, been changed, but also in other organizations, contracts are up, our contact person changes, and every time that happens, in a sense, we have to start over. The first time I met with one of the contact persons, I had to explain what dementia was. And I could remember her asking, but is that a problem? Is that a problem in Suriname? Do we have people with dementia in Suriname? That was the extent at the low point we started at. So it's not that people aren't willing to help, it's just a lot of the misconceptions, a lot of things that they do not know or do not know yet, has resulted in us having to explain it every time and trying to get the contacts to work with, to get in the door, so to speak. to work on our national dementia plan. And because we have no starting point, there's no way that we can refer to, for instance, talking with the general practitioners or with other organizations to refer to, well, there's a document or there's data or there's proof, so that we can get others on board. So the starting was for us the most important. Currently, I'm happy to say that we are in the process of writing the first draft of the National Dementia Plan. And since I think a week, we have a formal contact with the Ministry of Health and probably a collaboration with the PAHO Suriname. So the message really is that if you know what you're doing and why you're doing it, it doesn't matter how much speed bumps the road has. I think that if you just keep at it and believing in, keeping in mind the people you're doing it for, I am completely sure that it would work out. Why we need a national dementia plan, it is very important. Like I said, every time a new government, we start over. And if you have somebody there that doesn't deal with dementia or hasn't the knowledge about dementia, then they're not inclined to sit with you or to back a plan that on dementia. So with a dementia plan in place, we will lose less time. We do not need to start over every time. It is clear, it is transparent for everybody what needs to be done, how we will do it, and what their part is in the whole plan. Because also you will get one ministry sending you to another ministry. So with the National Dementia Plan, we are hoping that everything will be clear and we have a starting point, a document that we can refer to, that we can write protocols from, so that not only we have a working plan, but I think the spin-off to all the sectors would be very big. A roadmap, I hope, will come out of the plan because everybody can see exactly where they are, what lies ahead, and how they need to get there. And not only the people living with dementia, not only their families, but the doctors, the economists, the government, everybody. So I think that's that. Thank you for your attention.
Thank you very much for joining us this morning, Dr. Takehome, and for the work that you're doing in Suriname and for your inspiring work. You know that there's a roadmap and we just have to keep going. It's interesting to see the charts that some colleagues from other regions also identify with the situation in Suriname. So you're not alone. And the reason for us to do this is because we want people to know that they're not alone, that we're in this together. Okay, so this was just a snapshot of the work that colleagues from civil society are doing in the region. And I want to thank them, thanks all the presenters that they have, this positive and relevant experience in the dementia response. And this can be replicated in various contexts. So the next session will be coordinated by my colleague, Patricia. Dr. Morsch, the mic is yours.
Thank you, Claudina. And good morning, everyone. It's a pleasure to serve as the co-moderator of this important regional meeting. In this next segment of the meeting, we'll have a presentation from two expert researchers. Dr. Ishtar Govaya. Dr. Govaya is one of the leads of the multi-country dementia care improvement study called Strengthening Responses to Dementia in Developing Countries, STRIDE. The next presenter would be Cleusa Ferri, who is one of the leads of the STRIDE Brazil initiative. Dr. Ferri contributed to several World Alzheimer's reports, which is published annually by the Alzheimer's Disease International, ADI. Their presentations will focus on research studies for coordinated responses to dementia. Dr. Govaya, the floor is yours.
Thank you, Patricia. And thanks again to PAHO for having this session and for working on this very important topic. So our approach in terms of coordinated responses to dementia can be summarized by the phrase, begin with the end in mind. The end being to improve the quality of life of persons living with dementia and their carers, and to reduce the current and projected burden of dementia in the region. Our research is driven by principles central to implementation science: co-development, capacity strengthening, sustainability, and scalability. It uses multiple methods, including qualitative methods and community-based participatory action research. Our team's activities in this area were formally initiated in 2015 when I joined the Caribbean Institute for Health Research as a faculty, which coincided with my return to the UWI Mona from a research fellowship linked to the Michigan Alzheimer's Disease Center and the MacArthur Research Network on an Aging Society. Desk review and reconnaissance indicated that the dementia care landscape in Jamaica needed research-driven health services and health systems improvements. After 4 unsuccessful funding applications for situation analyses, risk reduction interventions, and epidemiological investigations, including the collection of genetic data, our work in this area began with seed monies obtained with collaborators from the University of Manchester. We conducted a scoping review and consultation exercise, which indicated a lack of awareness, which indicated as well a marginalization of African Caribbean persons in and across national settings, and that dementia care needs needed prioritization in both the general public and among healthcare professionals. It spoke as well to the inadequacy of care for these populations and class-based divides in care. The London School of Economics led Strengthening Responses to Dementia in Developing Countries invited Jamaica to participate in a comprehensive program funded by the UKRI Global Challenges Research Fund from January 2018 through next month, December 2021. This program began with a theory of change, also called a TOC, with academics, non-governmental organization representatives, and persons living with dementia and their carers from the 7 participating countries: Brazil, Indonesia, India, Jamaica, Kenya, Mexico, and South Africa, in London in March 2018. Driven by the impact goal that people with dementia live well and their carers do not shoulder excessive costs or burden, this TOC clarified what we committed to during the grant period, that is, before what we call the ceiling of accountability in the theory of change, and what, while not within the scope of work possible during that grant period, country teams could help set a foundation for. Each of the countries then held local theory of change workshops with stakeholders to adapt the overarching theory of change to their country's needs. In Jamaica, our stakeholders clarified research capacity, knowledge exchange, collaboration, inclusion of persons living with dementia, and prioritization of dementia and political will as foci for within the grant period. These were also further refined in regular meetings of our National Advisory Group with members, including representatives from academia, non-governmental organizations, and development agencies, as well as faith-based organizations. To prioritize these impact goals and equitable collaboration across a range of national and regional stakeholders, our team of multidisciplinary knowledge exchange experts communicate research activities and findings in formats accessible to a wide range of stakeholders, including laypersons and the media. Our co-development approaches include standing meetings with stakeholders such as the WHO Brain Health Unit, internal and external STRIDE webinars, assisting the Ministry of Health and Wellness with data collection efforts for the Global Dementia Observatory, and co-developing the agenda at regional and global events. We have received and met media engagement requests on behalf of Jamaica, the Caribbean, and Alzheimer's Disease International. We have also received and met requests to address dementia-related issues in the capacity of trainers, expert panelists, trusted presenters, and/or advisors. Our country-specific situation analysis highlighted the need for policy prescriptions for dementia, the generation of evidence related to stigma and dementia, as well as evidence to map and generate alternatives for the current disproportionate provision of dementia care by informal carers, the majority of whom are female, girls, and women, and the need for clear dementia care pathways, especially with respect to diagnosis and post-diagnostic supports and guidelines for dementia care. We have had 2 papers published already specific to the Jamaica experience related to these areas, and our other papers in progress in these areas are due to be submitted before the end of March 2022, which is our no-cost extension that the project was granted because of COVID and GCRF funding cut challenges. We have also had success with impact goals that built on those articulated in the local theory of change and that were refined by our National Advisory Group and other stakeholders throughout regular exchanges. After being an invited speaker at the Davos Alzheimer's Collaborative December 2020 Lausanne 8 workshop for leaders and innovators in Alzheimer's disease, in March this year, I was invited to lead a Jamaica team of 1 of 6 sites invited for flagship implementation research projects that is piloting the use of digital cognitive assessments and blood biomarkers to facilitate diagnosis of Alzheimer's disease as distinct from other neurodegenerative disorders. We are in the post-award administrative phase, negotiating and finalizing contracts, staffing, and awaiting ethical approval for our pilot, which will focus on private healthcare providers in the Kingston and St. Andrew parishes. This project involves working with our Institute's Tropical Metabolism Research Unit for the collection, processing, and shipment of blood samples, and our Institute's Barbados-based colleagues for analysis and reporting of the data. We are also growing a program of work related to addressing the dementia treatment gap by targeting the paid and unpaid care workforce. This program of work is focused on culturally and contextually appropriate adaptation and implementation of evidence-based and evidence-informed interventions to support persons living with dementia and their carers. With colleagues in Switzerland and Cuba, last month we submitted an application for cross-country feasibility and efficacy work on the WHO's iSupport online training program. Through a seed grant with colleagues at Emory University, in May this year, we also started feasibility work related to a culturally appropriate virtual adaptation of the Savvy Caregiver program, and are submitting a grant to the Alzheimer's Association for adaptation and efficacy work for in-person training of domestic workers. What then are our takeaways and lessons learned about research for coordinated responses to dementia? First, co-develop the research with the stakeholders. This means, for example, that people living with dementia and their carers must be involved in the conceptualization through the dissemination. They must not just be engaged for data collection. Similarly, for policies to be not just developed, but implemented successfully, policymakers at each level must be engaged and must buy in to the program of research. Second, align research with the needs of the target beneficiaries. Target beneficiaries may not be obvious, and so it is important to do relevant reconnaissance and mapping to get a clear sense of who the target beneficiaries really are, and to learn how they articulate and define their needs. Third, prioritize knowledge exchange. This facilitates mutual learning. It needs, however, to prioritize strategic communication and transparency. We are excited about all the partnerships and opportunities to work collaboratively to improve the quality of life of persons living with dementia and their carers, and to reduce the current and projected burden of dementia in our regions. Please do reach out to us, as we are keen to learn from other Caribbean countries, other Latin American partners, and to participate in your research and or to help replicate and extend any of the research we are currently undertaking, or even to think through new ideas. We thank you for your time and attention.
Dr. Fahey, you can proceed with your presentation.
I think Andrew maybe is going to share the screen.
Yes, here it is.
So good morning to everyone. Thank you, Patricia, and thank you all PAHO colleagues for organizing this meeting and for inviting me. It is a pleasure to be here with colleagues from AGI as well, WHO, and PAHO, and all representatives from all over Latin America, to discuss obviously a subject that we think is very important, the current burden of dementia in Latin America and our potential responses to it. And next. I'm not going to take much time on here. There has been important progress in the region regarding mortality and life expectancy. There are over 8 million people, over 60 in the region, with an important variation in the proportion of people between countries. Life expectancy at birth is above 70, and I would like to call attention that there is also big variation here, from just above 60, for example, in Haiti, reaching 80 in Chile. Next. Population aging is for sure, no doubt, a very important contributor to dementia burden in the region and everywhere. And according to the GBG, there was 3.3 million people with dementia in Latin America and the Caribbean in 2018, representing a 50% increase in the last decade. However, these estimates are based on a limited number of studies. Next. If we don't consider the number of, the quality of these studies, we could say that there are more than 25 epidemiological studies on the prevalence of dementia in the region. And they cover only 14 of the countries. In addition, they are also concentrated in 3 countries, as you can see in this map that we have produced, where you can see the blue Brazil with the bigger number of studies. And then we have Mexico and Cuba. So they are concentrated in the most studies concentrated in 3 countries. Great part of these studies also, as I said, evaluated urban areas, so we don't know much about dementia in the rural areas. So I would say that this scenario does not give us a real picture of what is the prevalence of dementia in the whole Latin American area, in the Caribbean. It's a diverse region with great ethnic, cultural, education, and socioeconomic diversity. Even if you think about Brazil only, this is the case with, we have several studies in Brazil, but in nearly all of them were conducted in the state of São Paulo, which is the richest country. So this highlights the lack of representativeness of the available evidence. So we have been commissioned by the Older Health Department from the Brazilian Ministry of Health, called COSAP. I believe my colleagues from COSAP is here today. To do the first national report on dementia in Brazil. And as part of this, we are doing what we call a Delphi consensus with specialists from all over Brazil to estimate the prevalence in other regions and the states than only São Paulo. Thinking that with this, we reach a better estimate of the prevalence and the number of people with dementia in the whole countries, and hope to use these estimates to use in the STRIDE project that Ishtar mentioned to you for the costs and have a good estimates of costs for dementia in the country, in the whole country. Next. Here is a prevalence rates using the GBD 2016 estimates, and we can see a great variation of prevalence between countries there, being Brazil the one with the biggest prevalence, in this color orange. They are based on estimates of original studies, and these estimates between studies varies considerably too. And this could be a true variation between countries on prevalence, but they could be also due to the methodological differences, including study design, sample size, diagnosis criteria, among other factors. Next. So in relation to the epidemiology of dementia in the region, and not just prevalence as I mentioned before, but also on incidence and mortality, for which evidence is even more scarce, we need more studies. Repeated over the years that we can see tendencies over time, better coverage, more countries with epidemiological data and better country representativeness, and also better quality and harmonization of methodologies used in these studies. On quality and harmonization, I would like to mention two important initiatives in the region. One is the HRS sister studies, which are general health and aging studies of national representative samples of people over 50, has been conducted not just in the Americas, but in other regions of the globe. Brazil, Mexico, and Chile have conducted these studies. In Brazil, it has been financed by the Brazilian Ministry of Health through, again, the Old Age Health Department, COSAP. The baseline of more than 90,000 participants, representative of Brazilian aged 50 and over, was conducted in 2016, and the second wave in 2019. There is also an initiative within this aging and health studies. There is an initiative called HAGE-CAP that stands for Harmonized Cognitive Assessment Protocol. It's a network, an ongoing international research collaboration funded by the National Institute of Aging to measure and understand the dementia risk within these ongoing longitudinal studies of aging, and have the aim to harmonize methods to facilitate cross-national comparisons. So Mexico and Chile have already conducted in these inbuilt studies of dementia, and we in Brazil should start a pilot next year in partnership with the UCL at the UK and the NIA in the US, and hope to have in the future a dementia study with a more national representativeness. We have to mention the contribution of the 1066 studies as well, with a sample of nearly 15,000 people aged 65 and over, 10,000 of them from 5 Latin American countries, have made a substantial contribution to the understanding of dementia in the region. Next. I would say that this is one of the 1066 contribution, with the majority of their sample in Latin American countries. The 1066 studies have shown that dementia is the biggest contributor to disability and dependence among people aged 65 and over, and dependency here meaning needs of care most of the time. Every person experiences dementia differently, we know that, but in general, due to its progressive and disabling nature, everyone will at some point need help in carrying out the activities of daily living. So the burden of care is mainly on family members, as some colleagues have already mentioned here. The main caregivers, they often have their own health compromised due to this responsibility. Next. We have only few studies on dementia costs in the region. The financial costs of dementia, we know they are higher in rich countries, mainly due to age composition, but also by their higher rates of diagnosis, treatment, and care in general. However, the proportion of informal costs is much higher in poorer countries. Here, I'm just giving this data for Brazil. It's a single study conducted in a academic clinic in São Paulo, that shows that almost 2/3 of the total costs come from informal care provided by family members. With this STRIDE project, and this international initiative that includes 3 countries in Latin America, as I mentioned before, Mexico, Brazil, and Jamaica, we will have more data on dementia costs in the region and in the near future, together with the work also that we are doing for the national, in Brazil specifically, for the national report on dementia. Next. Despite its importance, the knowledge, as some of you have already mentioned here, about the knowledge about dementia is not great among the general public and even among the health professionals, which contributes to a lack of timely diagnosis and treatment. We know little about the underdiagnosed rates in Latin America and the Caribbean. We don't have studies publishing and finding what are the rates. But we know that they are high, even in high-income countries. In Brazil specifically, using the national health system on the use of anticholinesterase, we estimate that more than 70% of people with dementia in Brazil are not diagnosed. This means that if we estimate that we have about 2 million Brazilians with dementia, 1.4 million are not diagnosed. As I said before, next please. As I said before, dementia knowledge is low among general public and health professionals, and this is an important contributor to dementia underdiagnosis. Deborah, our colleague working this STRIDE, she did a systematic review on studies on stigma and dementia in the region, and she found very few studies, only few studies. Within the STRIDE project, we are developing an intervention with general health workers in the primary care system, which we hope will contribute to reduce stigma and increase knowledge and recognition as well. We are starting a feasibility study in the beginning of next year to test this intervention. We do not have time here to discuss other potential reasons for the high rates of underdiagnosis. That includes, for example, the inherent difficulty of making diagnosis in older people with multiple chronic conditions. But is undoubtful that the importance of the access to services that meet the needs that people with dementia in their cares have. Next. So, we know that the services in the care can occur in different settings. We have already highlighted the little data that we have on epidemiology and burden of dementia, but also we know that we know very little how health services are meeting the needs of older people with dementia in their cares in Latin America and the Caribbean. And these are concerned with the care and treatment of people with complex mixture of needs related to aging. So it's not a simple task. I'd like to mention here an initiative that I understand PAO is also involved with the Brazilian Ministry of Health to develop what we call in Portuguese linhas de cuidado. I think I would translate as care pathways for more than 20 different conditions, including dementia. I am working with the Brazilian team to create the care pathway for dementia within the Brazilian National Health System to improve a patient's journey, through the several stages of the disease, and the carer's journey as well within the Brazilian National Health System in all levels of care. We are confident that this will contribute to improve the journey of patients and carers within the system, and may be an initiative to be expanded to other Latin American countries and the Caribbean. Next. And finally, I'd like to let you know that yesterday The Senate in Brazil, Brazilian Senate voted and approved a dementia plan. I understand that they still need to be approved by another sector that's called, I don't know if my translation is correct, but approved by the Chamber of Deputies. And if approved, more than anything, will be very important for us to work on its implementation. So they are independent of the dementia plan. In Brazil, there are several other municipalities and in the state dementia plans, as well as other initiatives supported by different sectors of the Ministry of Health, such as the initiative I've just mentioned on care pathway. Also, the implementation of the iSupport in Brazil is a partnership of the Ministry of Health with WHO and another university in Brazil. We are also doing, in partnership with the Ministry of Health, this, as I mentioned, the first national report on dementia, and which we believe will provide a detailed picture of the current situation of dementia, as well as important elements for planning of care for people with dementia, its recognition and also its prevention. It's important that different initiatives in each country are integrated in order to contribute to the development of a national strategy that uses existing resources, effectively incorporating new elements to ensure, in addition to prevention, that I haven't talked here about prevention, but it's another very important point, and there are lots of research that can be done in this area. But to new elements to ensure that the care and support for people with dementia and their families, the support that they need. That's what I would like to say. Thank you very much for attention.
Thank you both, Dr. Ferri and Dr. Gouveia. You have provided food for thought and information on how to utilize research in low and middle income countries. I would like to point out the importance of the engagement of older people with dementia and their caregivers, and having this collaboration and multi-sectoral participation on the research developed, as very well mentioned by Dr. Gouveia, because, and also both of them mentioned the importance of having evidence-based information to be able to have policies and dementia care plan, and also address caregivers and their needs appropriately. And Dr. Ferri mentioned the importance of conducting more research, because we do have some in the region, but not enough. So it's very important for countries and everybody to be engaged. And all this information that they provided is very well aligned with the decade of healthy aging that Dr. Vega mentioned earlier, and all these areas of actions and work on the decade. To continue the meeting, I would like just to remind you all to put your questions that can be answered by the presenters later in the next session that we have on questions and answers. So you can put them on the questions and answers sections, and we're gonna be analyzing them to ask to the presenters. So the next segment is a panel of two presenters on the association's experience with persons and careers of people with lived experience. The first presenter is the general manager of the Fundación Transcender con Amor, Servicio y Excelencia, FASE, de Ecuador. Ms. Maria Veronica Faini will be presenting on her foundation's experience with persons and careers of people with lived experience. And the next presenter is Ms. Edna Williams, director of the Virgin Islands Alzheimer's Association, a Caribbean woman born. She's the founding director of the Virgin Islands Alzheimer's Association. The association received its nonprofit status in 2016 and became a member of Alzheimer's Disease International in 2019. It is also received the status of Dementia Friends British Virgin Islands in late 2019. Ms. Maria Veronica, you can start.
Hola, buenos días con todos. Muchas gracias.
Hello, good morning. I will refer to innovation and what we have done in family care for Alzheimer. I am Veronica Faini. Just a second, my screen is frozen. We are the foundation called Trascender con Amor y Servicio y Excelencia. That means to reach out with love, service, and excellence. We have been working for the past 10 years in prevention, training, awareness, and improvement of the quality of life of people with Alzheimer, families, and caretakers. And then those are the people that have the worst burden or the heaviest burden. And we are members representing Ecuador in the International Alzheimer's Disease International and also Alzheimer's Iberoamerica. We work with academics, the private enterprise, health professionals, caretakers, families, and the government. I will be concentrated on 3 topics. The first one is the participation of the private section in community actions of public interest. And the second, the initiatives that join digital and in-person experiences. And to talk about the first topic, some speakers have already mentioned that because of the political stability, it is difficult to get initiatives started in the public sector. And then we have to consider real changes in this type of initiatives. And we at the foundation believe that the key in terms of education, information, diagnostic, prevention, and therapy, we want to make sure that we have a lot of people, that everybody is linked, private enterprise, all society. We have to have the support of the public sector. We have to work in synergy with other sectors of society so that all of us can contribute to the recognition of Alzheimer's as an important disease as a catastrophic disease also. In that sense, in the past 10 years, we have been able to work with 30 enterprises. These are the most important in the country. Some of them have more than 5,000 people. And then around those 5,000 people, we see many families, and we have been working not only as sponsors of these initiatives, but also we have been able to motivate these enterprises so that they can have social responsibility. They can work outside their boundaries and they can work in society so that we can have people involved. We have penetration of this idea in a more tangible and a real world. And yes, this is evident that it has value in the long terms. Now I'll show you a video which was one of the main tools or the first tools that we prepare for one of the enterprises and the companies. And this will show what are the benefits that I am mentioning.
Perdón, se me hizo muy grande la pantalla.
Apologize.
Mil disculpas.
I apologize. My slides are out of order now. One of the things that we have done is working with public enterprises so that they know we can have tangible activities. We can take this to the population because they are things are of general interest. We have worked on strategies and digital and in-person tools. We know that many people, and depending on the generation, the consumption of information is different. So when we reach young generations, we are thinking of mobilizing all sectors. Many of the scenarios and information that we had in digital form, we had to, in 2019, to the opportunity to discuss them in a Congress in Quito, to be able to document some of the talks of professionals coming from around the world. And we wanted to make sure that the testimony given by these people who had been around the world, we would just concentrate that in virtual types of information. And then we have been able to have a very healthy network of volunteers. And then we have different ages there. We generate a system there that allows us to see tangible results in real time. So for us, this is a tool. These virtual tools are good, a good tool for us to move things, to lead to concrete actions in different areas of towns, in different sectors of society. And then that way we motivate all sectors of civil society to give support to the development of a public plan by the government.
Verónica, solamente para avisarte que ya
Verónica,
necesitamos por los tiempos pasar a la otra presentadora.
we need to go to the next presenter. So could you please finish? So this type of initiatives is one initiative that can reach many people. We have reached millions of people here. And through time, we have people with different ages and different generations. And today we have been able to reach many countries. So I will now stop projecting. I think I thought we had 20 minutes, but now we don't have them. But then basically, it is very important to be able to have synergy among the sectors, the different sectors of civil society, to make sure that we have something happening in the different platforms, both at the initiatives, public and private levels. So we have pushed very hard. We have pressure for policy, and many things have gone ahead within the Ministry of Health. But then, of course, we have government and administration changes, and these changes, of course, sometimes do not allow for continuity in the long term. So the other topics will be there at some other point in time. We will be able to tell you. Yes, I will definitely give the floor to the next person. Thank you very much.
Miss Edna Williams, the floor is yours.
Yes. Good morning or good afternoon. First of all, I want to thank PAHO for allowing me to be part of this technical presentation or technical meeting, and the Ministry of the Virgin Islands for giving me permission to attend this meeting. First of all, allow me to set the scene for you. The British Virgin Islands has a population of approximately 30,000 residents. It's a small, close-knit community in which personal privacy is valued to the extent that denial and secrecy perpetuates the stigmas surrounding dementias. By the time individuals are diagnosed, if they get diagnosed, they are in the middle to late stage of dementia. They have walked away from home, they have gotten lost trying to find their way home, or have exhibited extreme behavioral changes by which the police or medical intervention had to take place, just to name a few. This is a situation which triggered the Alzheimer's grassroots movement within the BVI. Now, a grassroots movement is one which brings together, organize, and mobilize individuals to take actions intended to influence social and political issues. Well, ours is the bringing about an awareness of dementia, supporting persons and carers with lived experience and challenging stigma. The movement consisted of members of social clubs, social service clubs, such as Rotary and Lions, family carers, persons with family members with a dementia, and friends who just were interested in being part of the movement. Next slide, please. You went one too far. Okay. I think I'm out of sync. Our first activity took place by us, actually. Our first campaign, basically, was the 10 early warning signs, where we actually went throughout the community, presenting the early warning signs to various community organizations, such as Rotary clubs, churches, Red Cross, youth groups, insurance company, health fairs, basically any organization or group of employees that wanted to learn about dementia. Next, please. We then focus our attempts on to mobilize the community and join the World Alzheimer's Month campaign, highlighting Alzheimer's Disease International, and always with a BVI personalized sub-theme. Remember me, see the person, not the disease, creating awareness and promoting prevention. It took place, these activities took place on such things as walks, candlelight vigil, information tents, and branding awareness, such as the sale of branded t-shirts and face masks. Next, please. Another campaign is June Brain Health. With a focus on youth, June is Brain Health Month in the BVI. In collaboration with the Department of Education, children marched through the capital, led by the local group of motorcyclists in full protective gear. And this was important because there are many youth who ride without protection and have been in accident and have experienced head injuries. These youths demonstrated how they love their brain through art, music, and poetry. Next, please. As the movement grew, the need of carers became more evident, and as a grassroots movement, we addressed these needs, and support groups became part of our agenda. The You Are Not Alone support group developed in the hopes that to bring family members together to share and discuss issues. There is the future hope that individuals with lived experience will become part of this group. We then looked at those family members, the children of family members who are seeing and experiencing changes within their grandparents. So we created a youth support groups to give them a sense of belonging and sharing experiences and recognizing the signs of dementia and being able to be support to their family as they grow. As a grassroots movement, We keep our pulse on the needs of the community. The cry for trained dementia carers was heard. The VIAA responded to those expressed by the Red Cross and conducted a dementia module in their caregivers program. The authors of Living in the Land of Dementia conducted training sessions to caregivers. Come February, through the funding of Rotary Club of Road Town, February 2022, 50 caregivers will be attending an online certified dementia practitioners training program. And this will be sustained through a train the trainer program of one of our members. Next, please. The association continually worked towards its vision of being a dementia-friendly Virgin Islands. So in March of 2020, our initiative of Dementia Friends became a reality through Alzheimer's Society of the UK, ADI, and a volunteer Dementia Friends champion of the University College of London. 151 frontline employees became Dementia Friends. Employees of the local police department received this education. Bank tellers, BV or Electricity Corporation or telecommunications staff all received this training. Unfortunately, the sessions had to be cut short due to the onset of COVID. It is our hope to continue this program in the future. And through this program, 5 members of the associations were trained also to be Dementia Friends champion to ensure that this program or this initiative is continued. Next, please. Again, as a grassroots movement, we heard and see what was happening within our community. Family members are complaining that their relatives are being taken advantage of financially. So VIAA sponsored sessions on estate and legal and financial planning. We are fortunate to have a medical and legal advisor within our team. The estate planning was led by Money Matters, a program of BVI Financial Services, and the Real Talk on legal and financial planning was facilitated.
Ms. Williams, your microphone is mute.
Can you hear me now? When did it go mute?
Yes, just a while, just a little bit,
Okay.
just a little bit.
Okay. This estate planning, legal and financial planning went over very well because we had responses and contact by family members through our Facebook. If you want to be a successful movement, you must pay attention to public relations and branding. And of course, next slide, please. And of course, that is one of our strong points. We brand our t-shirts so that when anyone walking in the community, they will see our t-shirts. We present on various media platforms, such as the local talk shows. There was even a point when we actually took over a local talk shows, in fact, more than one time. We, as far as the public relations, we had banners. During this past September, we had flags up around the central part of Road Town. We lit the roundabout purple. In March of last year, with the advent of COVID, we decided to purchase and get made face masks, which sold like anything. And then that continues our branding within the community and for the community to know that we are here. In order to be successful in these days and time, you must have a presence on social media. We can be found on Twitter, Facebook, and Instagram. Next, please. Grassroots movements are strengthened by collaboration. So VIAA's success thus far is due to collaboration with various groups within the community. Rotary clubs, Lion clubs, local telecommunications company, major insurance companies, financial service corporations, Social Security, and the Red Cross. Without our partners, we wouldn't be as far along as in the campaign as we are in raising awareness, educating the community, providing care and support, and fighting the stigma. We are now challenged to increase the opportunity of proper diagnosis and ensuring Dementia National Plan in the near future. I want to thank you, and I hope you did not miss any of this.
Thank you very much, Ms. Williams and Ms. Veronica, for your presentations, and especially for your commitment and the important work that you do, making a difference in the lives of people living with dementia. Our final presenter for the day is Dr. Catherine Sihir, Technical Office, Brain Health Unit, Mental Health and Substance Abuse Department from WHO. Dr. Sihir has been involved in drafting the Global Action Plan on the Public Health Response to Dementia, as well as the Global Dementia Observatory, an international surveillance platform of key dementia indicators. Today, she'll be presenting on the Global Dementia Observatory, GDO.
Thanks a lot, Patricia. Good morning, buenos dias, buen dia to all of you. I hope you can see the correct screen. I'm having a split screen and we did a practice run, so I hope you can see this properly.
Yes, we are. Thank you.
Good. Yes, so I will tell you today about the Global Dementia Observatory, and in particular how having systematic monitoring through the GDO can really support us with the implementation and drive the implementation of the Global Action Plan globally and at country level. And before I jump in, I wanted to say that it's been just amazing to hear, all the fantastic work that's happening at country at country level. And I'd love to see, some of these success stories really be reflected on the GDO. And I'll come later in my presentation to points in how we might be able to do this. Now, I need to figure out how I can switch to the next slide. Yes. So the Global Dementia Observatory is the monitoring mechanism for the Global Action Plan, but it's also strongly linked to one of the strategic action areas, and that you see here on this slide. So you've heard very early today from Tarun that the action plan has 7 strategic action areas. And Tarun presented all the different tools that are available to support countries. And the GDO and the monitoring is really the one key tool that supports countries in realizing Action Area 6, which is on health information systems. We have, as you also heard earlier in the year, launched the Global Status Report, where we presented for the first time the data that 62 countries worldwide have submitted to WHO. While these 62 countries are only about 1/3 of WHO member states, which is a bit disappointing, and we see about the same rate for the region of the Americas as well, the positive side of this is that those 62 countries cover about 65% of the world population. And if we only look at the population that's aged 60 and above, we're reaching about 76% of those. So this is a little bit of the silver lining. The GDO, as we call it short, was initially developed as a country support tool. It's meant to support evidence-based decision-making, inform policy-making, and helps monitoring the progress, not only us at WHO to monitor the progress of the action plan implementation, but it also supports monitoring at country level. And I'll show you in a second how this is done. The other exciting part of the GDO is that it facilitates knowledge exchange and mutual learning. And a little bit later, I'll show you what the knowledge exchange platform can do. But let's focus first on the GDO framework and how it's set up to monitor the progress of our global action plan. As the monitoring framework, we need to somehow capture the vision of the global action plan. So this is what you see here on the right. This is what we want to achieve through the 7 strategic action areas that you see on the left. So these are really kind of like the boundaries of the framework. With the 7 action areas come global targets that member states collectively have signed up onto trying to reach by 2025. And if we do, that comes with certain impacts. For example, if we reach the global target for action area 1 on policy and legislation, it means that dementia is becoming a public health priority in countries. The same is true for other areas such as awareness and friendliness, which would then mean that society overall is more aware of dementia and is more inclusive of people living with dementia and their carers. And now this, what you see, or the beauty of the GDO is really that we can use it as this kind of logic model. We know where we want to go. We know the impact that we want to create. We have strategic action areas that make recommendations on what countries should be doing. And in the middle, that's sit the GDO indicators. We have 35 of them. They all come with kind of like leading STEM questions and then a couple of sub-questions that help countries assess how they're doing in each of these areas. Yes, and to show you now what that looks like in action, so to speak, I've prepared a little example here. So we've heard earlier from Tarun that at the moment we have 50 WHO member states that have a dementia policy or plan, either integrated or standalone. That's one of the GDO indicators. But we can then look at the sub-indicator level and look at what aspects a policy or a plan actually covers. And when we do that, we see that 36 GDO countries include some sort of awareness raising or stigma reduction or promotion of dementia-friendly initiatives in their plan. That's kind of like the objective that they've identified. We can use a different GDO indicator now to check on implementation. So there is one that measures whether or not a country has or runs awareness raising campaigns or has dementia-friendly initiatives. And if we combine the information of these two together, we see that of the countries that have a dementia plan that includes awareness raising, 87% of them actually ran campaigns and 96% of them also implemented dementia-friendly initiatives. So this is very, very encouraging, and it also shows us that policy action slowly trickles through. And we can do the same exercise for other action areas. So this was just one example. We can do the same for risk reduction, and we see implementation rates of up to 78%. For other areas, it doesn't look quite as nice. To now show you how easy it is to submit GDO data and collect it, is we have an e-tool that's available in English, French, and Spanish. It shows on the screen the STEM questions and then asks the follow-up questions. It's a smart tool in that it will jump or skip questions that are not relevant. And if at any point in time, people are not sure about what a question means, there is a reference guide that provides a great deal of explanation and definitions. Once a country goes through this exercise of submitting data, we at headquarters receive the data, we check it, and we can prepare these kind of country profiles. And here you see a schematic or an example of just one random country. You see again, you have at the top just some generic information, and then key indicators across the 7 strategic action areas. And we use a simple traffic light system to indicate which areas are going okay and where there is room for improvement. And with this traffic light now, what you can do is you can go on to the GDO Knowledge Exchange platform, which is available at www.globaldementia.org. You can browse for exactly the action area that's identified as a potential gap or weakness, and see and browse through the resources and the different tools that have been submitted for that particular area, just to get an idea of what might help to now close that gap. So the GDO is really about not only monitoring progress and identifying where there are weak spots, but it's also about showing solutions and potential things that you can do. All the resources that have been submitted to the platform were actually proposed by members of the community. There is an online form that one can submit, and I really encourage all of you to submit the things that you've spoke about today to the platform, so that others beyond this meeting today can learn from your experience. All resources that are submitted then undergo peer review. And this is a very central point for us. We have a great network of dementia experts worldwide that offer their time to review. And we have a brilliant group of people with dementia who in focus groups also assess the resources that have been submitted. And that assessment is really meant to just introduce a quality check to make sure that resources are relevant for multiple settings, that they are adaptable to different cultures, that they follow principles such as person-centeredness, human rights, that they involve people with dementia and are inclusive, and are some sort of innovative. Once a resource has been approved through peer review, the WHO Secretariat will then create a page on the platform so that people everywhere can access it and browse through it. We also do monitor very closely the use and the uptake of the platform, and we're also interested to see how users respond to individual responses. And that's why we've included in the platform a function that when you sign in, you can actually start commenting on resources that you see. You can leave comments on whether or not you found that resource helpful, whether what changes you made to it when you adapted it to your own context and so on. So it's really meant to be not just a repository, but a platform for allowing bidirectional communication and conversation. So how can you engage with the platform is you can join us as a GDO peer review network. You can submit your resources, and you can, of course, create a user account on the platform itself and start using it. On the platform is also one button at the top that says view data, and that's where you can access the country data for the 62 countries that have so far participated in the GDO. And again, it's organized around the same 7 strategic areas so that it's very easy to find and navigate where you want to go. Within each area, there are key facts at the top that just see, okay, this is what it looks like at global level, and then you can browse through the data tables and see what information is available. So for now, we have done one round of data collection, which is sort of the baseline. We're planning to do a second round starting next year. So we want to make sure that we have more countries on board next year for the next round, so that more countries can benefit from the advantages that the GDO brings. And yeah, we're looking forward to working with many of you. Some of you we worked with in the past, and it was a great pleasure, and I thank you for your collaboration. And with many others of you, I hope to work in the future as we collect the next round of GDO data. And I think that was my last slide. Yes, thank you very much.
Thank you very much, Dr. Sihir, for your important presentation. I would like to encourage all member states to complete the GDO. And if you have any difficulties or need help, support to access the platform, please let us know. The link to access the GDO is on the chat. And you can also find the information about the GDO at the PAHO's mental health webpage. Now we open the floor for some questions to the presenters. I would like to encourage, if someone still have a question, you can post on the questions and answers section in Zoom. And right now, I would like first to address a question to Dr. Vega, which is what strategies have been utilized to encourage families to afford expensive medication in a progressively deteriorating condition? Dr. Vega?
Well, this is a difficult question, and I don't think that we have been developed any strategy to convince family to approach expensive medication. I think that we are working hard with the Ministry of Health to try to include some medication as a basic medication from the ministry for the list that the Ministry of Health developed for essential medicines discussion. I know that last week I have a meeting with McGill University about the Alzheimer plan in Quebec and how we could see for the future the inclusion of Alzheimer, expensive Alzheimer drugs in the horizon of the. I don't know why I'm speaking in English. No, yo creo que la inclusión de.
I really think that the inclusion of essential medication or expensive medications in the essential medication policy is something we haven't been working with much. But we should be talking about it. I had a chance to, at the last Alzheimer's Disease Association meeting, to talk about the delay in the use of these medications in the context of Alzheimer's disease in the developing countries. And I think that there are many priorities. Still, there are still a lot of priorities to respond to, particularly with the idea of placing the diagnostic issue or the early interventions into the risk factors and the potential development of the cognitive development. And in particular, the limitation of the functional skill deterioration in Alzheimer patients. Honestly, I think that the results of the most expensive drugs for Alzheimer's disease is still not quite compatible with the inclusion of these in the essential medications for older adults. And of course, we're not taking into consideration that in most of our countries, they're not in the economic situation right now to include them either. So I would focus on trying to expand our current possibilities with evidence-based support and the importance of developing early diagnosis and the importance of early interventions and the risk factors of the disease. And as a result of the results we've obtained, the potential maintenance of the functional skills of persons with dementia for as long as possible, and also interventions that have to do with support to the caregivers, community caregivers. I think that that would be the most important focus right now from the point of view of the Pan American Health Organization. Thank you.
Thank you, Dr. Vega, for your answer. I think Dr. Sihir want to say, complement something on the question.
Just to say that I really agree with what Enrique just raised, and to kind of remind us all that these very expensive drugs that are promising, but that are still very early on, they would only benefit or be for a very small proportion of people living with dementia. And we must not forget that there are so many more patients that would not even qualify for getting such expensive drugs. So keeping that focus of public health and driving risk reduction and providing care and support for all people with dementia, I think is a very sobering and important thing for us to keep in mind. Thank you.
Thank you very much. I think Paola wants to mention something else too.
Thank you. Yes, and from the point of view that Catherine just pointed out, there is, for dementia really is still care, which is the major therapeutic intervention that can happen. Now, we do realize the care is difficult and sometimes very costly, but there are plenty of small things that can be done in order to really improve the life of people living with dementia and their families, and also make some cost savings by increasing the amount of time that people can spend at home. So whilst we wait for more therapeutic breakthroughs and medicines, which we're all hoping may come, there is a lot that governments can do to improve the life of people. And so the discussion with our members, with ADI in this respect, with Catherine's team at WHO, with Dr. Cayetano teams at PAHO, can be absolutely essential in bringing forward small but very effective things straight away that can make life better. Thank you.
Thank you very much. I would like to ask another question to Dr. Govaya, which is also about the pharmacological and non-pharmacological strategies regarding public health. So the cost of pharmacological and non-pharmacological diagnosis and treatment in neurodegenerative diseases, especially Alzheimer's, are high. Public universal health, free of charge, currently do not have the capacity to assume the cost of such pharmacological therapies. So do you know any mechanisms that can be found to subsidize part of the treatment, how public health can work on that?
Well, our focus in Jamaica, and I think in some other Caribbean countries as well, is not necessarily on thinking about pharmacological intervention. So this is very similar to what Catherine was just saying. what we really encourage prioritizing are public health interventions that are preventative and public health interventions that are risk reduction. So we are very committed to and encourage each country to think about in their policies, in their plans, not just in one sector, but cross-sectorally, to really think about how we can embed risk reduction initiatives at the population level. So this means, for example, thinking about things like your transportation policy. It means thinking about things like your trade and your food and nutrition policies. It means really thinking of even early childhood education types of policies, because those are really important in terms of, if you think of COVID, and I know that Paola has spoken about this in many other meetings, and the real threat that COVID is presenting in terms of generations to come and their cognitive health. We really have to be thinking about interventions that are happening throughout the life course and that will be focused on improving the circumstances in which people live, work, play. So in terms of pharmacological interventions and neuroimaging types of interventions, we really also agree that these take up an enormous amount of resources that low and middle income countries tend not to have, because our healthcare systems or social care systems are so stretched already and under-resourced. So we think we need to be approaching those types of interventions with a lot of caution.
Thank you very much, Dr. Govaya. And I think it is very important. Okay, let me just give the word to Claudina first, and then I'll ask you another question about this that you were saying. Thank you. Claudina.
Just to add to that in discussion, which I think is very interesting, that we are all agreeing that although pharmacological interventions are relevant, but there's some certain things that definitely we need to be thinking that may not be so costly, the early intervention. And I think we agree with Paola, with Easter, we need to focus on early intervention, and we need to make sure we have tools, we have image gap. Please ask us to how best we can support your country in doing training for your healthcare providers, and how they can, the issue of stigma that it has been mentioned, but I wanted to focus on these tools, early intervention, support to care, support to family. Those are things that we can be doing, and I think it's cost effective. It has been proven to be effective. So thanks for I wanted to add to that response from the other colleagues. Thanks.
Thank you, Claudina. And I would like to add, considering what Dr. Govaya was mentioning about the prevention aspects and the importance to have other strategies. So we have a question about the research that has been conducted on causes of dementia and how to implement a preventive program on dementia.
Go ahead, Paola. You're muted.
But now, sorry. Yes, so there is a lot that can be done to create a preventative. We call it we don't call it preventative. We say risk reduction because there's no guarantee yet of prevention. The wonderful campaign that was created with PAHO, Let's Talk About Dementia, has an element of risk reduction. There are things that people really do not quite yet understand or absorb. So there is a lot around diet. Of course, there is a lot about health care in keeping, for example, the heart ticking, exercise. But there are certain factors that are typical only of dementia. For example, keeping the brain active. There is also an element which is more societally focused of education. So a brain which is highly educated or is engaged in activities that stimulate the brain is a brain that is more resilient ultimately to the onset of dementia, is a brain that will slow down the onset of dementia. There are also now new factors like, for example, pollution that we still don't understand entirely, and there is a need for more research. But once again, there are very simple steps. We have very clear infographics that detail very simply how to implement a campaign. Luis, who is following this meeting, will be sending you the link to the infographic so that you can have it, and it's super simple. But nevertheless, the PAHO campaign itself is a fabulous tool for everybody to use. What we need, though, is for this information to be pushed at primary care level. So what we have found out in our surveys in 2019 is that 62% of medical professionals still believe that dementia is normal aging, is not a disease. A survey by OECD in 2017 found out that typically in the healthcare professional career, only 12 hours of training are devoted to dementia. This is in the whole training period. So there is a need for governments to educate their own workforce more about this, because otherwise the strategies for prevention will not reach the end user, the person living with dementia, the family that would really benefit. Thank you.
Thank you very much, Paola and Dr. Govaya, Claudina, for all your information about this question. The next, well, I do have the information that Just Martins wants to say something. So you can have the floor.
Maybe he needs to be unmuted.
Yeah, I'm not sure. So I'm gonna, until we check this, I'm gonna pass the next question to Dr. Ferri. And it's about what you mentioned on your presentation, about the Brazilian Senate and how it passed the dementia policy. So we would like to know what were the steps and what has been done to have the Senate of Brazil to approve a dementia policy. And can you please highlight the main points of this policy?
Thank you, Patricia. And it was just yesterday, and this has been proposed by someone else with a very little participation of the general public and carers and people with dementia. So Elaine, I don't know if Elaine is here, I don't know if Elaine can talk, but we did a big campaign trying to change a few of the elements of this, what we call Projeto de Lei. This dementia plan I will call here, but I think it's a little bit different. But anyway, it is, so we tried to change a few elements. So first we did a big campaign with the Stride project, and we invited many people trying to bring on board, like Ishtar had addressed very well, that we needed to bring people with dementia and carers on research, on building up services. And we tried to do this with the Stride project, and trying to think that in the end we would have a plan where we would have the participation of all the stakeholders that we think are important. This didn't happen, but we managed to change a few things in the project, and we took something that I thought was very difficult, because they had an item to that medication could be, for example, used in Brazil without the approval of the local regulators, which we thought was a little bit dangerous, especially now that we have many medications come. You just talked about this and the importance and how expensive these medications are. So I think the elements that we agreed and was very important is that the responsibility of the what we call executive, that the Ministry of Health, on not just offering care, but also on making programs about dementia to increase awareness. We tried to make this nicer and better written to ensure a few things, but unfortunately we didn't. But I think that anyway is a good step, a very important step. As I said to Paola, we now need to the approval of the chambers of deputy chambers, I think it's called in English. So we hopefully then after that we will be able to make sure that everything is implemented. But I just like to say that a parallel thing that we've been doing is working with the Ministry of Health, the COSAP department that work with the health of older people, to ensure that many strategies, and as I mentioned in my presentation, many strategies are being implemented, and we are trying to integrate them to ensure that with a plan or without a plan in this official thing, we do have strategies that will be helping people with dementia and their carers to live better lives, we think.
Thank you very much, Dr. Fehi. And Eleni has contributed also on the chat. So if you want to check more information about that, is on the chat. Thank you very much, both of you. Now, Dr. Renato wants to add.
Thank you very much, Patricia, and thanks for all the comments. I can only add to what the partners are saying here, and that's the reason why we are here together. I mean, we need to join forces to be able to work together to advance in terms of supporting countries to strengthen the resources that they have available for dementia. We know that most of our countries rely in their health systems strongly on primary health care. So there is a lot that still needs to be done on developing the capacity of community health workers, on also understanding dementia and providing the correct information. In the primary healthcare system, we also have general practitioners, we have nurses who also need to receive a lot of information. So this is not something that we can do alone. We need to be together as partners, supporting the countries. And as Paola just mentioned, it's very important to have a line to follow. And that is the plan that the countries develop. And we are again here also as partners to support countries, work with other organizations to help countries to develop that capacity, to write plans, to put a strategy in place in a way that we can advance with this enormous work that we have ahead of us. There are many activities, but we know that as a region, we still have a lot to build on, and we can only do this together.
Thank you very much, Dr. Renato. I would like to pass now the floor to Just now.
Yes, can you hear me?
Yes, perfectly.
Okay, thanks very much. I would like to congratulate Pajo on this very timely and very excellent meeting for the region of the Americas. One thing I would like to stress is what we have been saying for some time since we met in November 2019 at the ADI conference in Ecuador with Enrique and Claudina. I think the importance of having a triangular approach to the work on dementia and the work on national planning, to have a triangular collaboration between the Ministries of Health, the PAJO, and the civil society organizations, the Alzheimer associations. I think only by making sure that these three sectors work together, work together, we can make sure that the national dementia plans and the work on dementia can be taken care of with all involved. That's the contribution I wanted to give. Thank you very much.
Thank you very much, Just, for your participation and contribution. The next question we have is for Dr. Sihir. It's about the GDO. So can GDO data be registered only as an institution, or it can be registered individually?
Yes, very good question. So GDO data is submitted by the ministries of health of a country and the designated focal point. But having said that, from our experience, that a focal point in the ministry very rarely has all the information at hand that the GDO questionnaire asks. So often we hear that they reach out and that they really use and utilize a large network, and that academia as well as civil society are, again, similar to what Renato has just said, we're in this together. So they're strong partners and providers of information, and also sometimes custodians of certain data that the GDO asks. So yeah, submission is done through the ministries of health, but with the support and help from many others in the background.
Thank you very much. The next question we have is for Dr. Renato, and it's about the relationship and coordination of work between ministries of health and the associations. So, Dr. Renato, how PAHO can give an extra support to the associations to be able to work closely with the ministries of health?
Thank you, Patricia, for the question. Our main work as the Pan-American Health Organization is to support the governments on their health strategies and health actions. So we mainly rely on requests from countries to establish technical cooperation. But of course, knowing the key public health priorities of the region, we keep a regular dialogue with the country to be able also to implement and support countries to take the best possible decisions in terms of the main public health priority. So that's the work that we do for dementia. We also do for all the Sorry, I was kicked out of Zoom for some reason, but I'm back. So as I was saying, we work together based on requests of technical cooperation. So what we need to do, and we need to do more, especially when we are talking here about dementia, is to be able, through our dialogue with the ministries of health, to involve civil society, to involve other partners that can also contribute on improving dementia care at the country level. So, but this is a process that can initiate for